let me listen to your lungs and see how they sound.
Okay.
Take a deep breath in and out.
At the Allegheny General Hospital Cancer Center.
Okay, let me just check your incision real quick. This little incision right here. Oh, that looks perfect.
77-year-old Pat BURSICK of Ross Township has every reason to smile these days. It was only a few months ago she went into a dark, desperate time, worried she would lose her active life with her devoted husband Jim of 53 years, daughter Marianne, and 2 grandchildren, and other loving family and friends.
Take a deep breath in.
Her fear of dying all started with a simple backache.
An upper backache, which was kind of unusual for me, and it wouldn't go away. It was a nagging kind of thing. So he ordered me a chest x-ray. Thought this was a little odd to get a chest x-ray for a backache, but I went and I had the chest x-ray, and they called me and told me I had a nodule on my lung and I had to get a CAT scan.
BURSICK was scared. She had smoked non-filtered cigarettes for 40 years. The CT scan results confirmed her worst fear. When they told you you had lung cancer, you had to be frightened.
Oh, I was scared to death. I thought I was going to die. I have a friend that just died a couple of years ago from lung cancer. She didn't have any symptoms either until she was stage 4, and she just died. And I thought that was going to be me too.
It was difficult news too for her daughter Marianne.
It was a very scary experience thinking about not having my mom. I'm an only child, so we're extremely close with both of my parents. My mom's my best friend, and we do pretty much everything together. Every time I've ever been sick or through the births of both of my children, my mom's been there to always take care of me.
So Marianne would be there for her mom now, and so would noted AGH cancer specialist and thoracic surgeon Dr. Lana Schumacher, who describes Pat's tumor.
Called pulmonary nodule. It had grown, and they did what we call a PET CT, and that's a lot in more layman's terms. It's a cancer scan. It lights up if you see cancer.
Pat's scan lit up. She had a cancerous lung tumor. For years, surgeons would remove large portions of a cancerous lung, leaving patients in terrible pain for months of recovery. But this video of Dr. Schumacher in a recent surgery shows the new robotic surgical techniques used at AGH. This newer surgery pinpoints and extracts the tumor in a less invasive way.
We do minimally invasive techniques with camera techniques, robotic techniques, such that their recovery is much easier. So all these things have helped the workup and also the overall outcome.
Less invasive surgery versus years ago, lung cancer surgery was a long haul in terms of recovery. Is that right?
Absolutely, yes. Long incision that actually went between the ribs, and you'd have to split the ribs, spread the ribs. So that recovery was very challenging.
After Schumacher used the new techniques to remove Pat BURSICK's tumor with pinpoint accuracy, she was up and around in just a few weeks and cancer-free.
It was non-invasive. I have like 4 little incisions on my right side, and that's how they operated on me. They removed the top lobe of my right lung along with the cancer. They tested all my lymph nodes and everything turned out clear. So I'm good. I don't have to have chemotherapy. I don't have to have anything else. It's like a miracle.
But the key here was that BURSICK's tumor was detected early by way of a CT cancer screening. Here at Allegheny Valley Hospital in NATRONA Heights and across the country, more and more women go through the same CT lung cancer screening as BURSICK did. Doctors are now urging women to get this done every year, the same as having a mammogram to detect breast cancer. Dr. Tom Colonius is a radiation oncologist who specializes in lung cancer.
Lung cancer is a disease that, if caught early, we can effectively treat. Unfortunately, it's caught most of the time later in the disease history, and at that point, treatments are not as effective. It's the second most common cancer in both men and women, and it's the #1 cause of cancer death in men and women. So we definitely have a ways to go as far as treating it, but really prevention and early detection are the key, just like in any kind of cancer.
So I'm going to just have you lie down on the couch here. Your head's going to go up to the right.
Colonius says the CT screening is a low-dose radiation screening, completed while patient simply holds her breath for 5 to 10 seconds. They include people who are between 55 and 74 years old who smoked 1 pack of cigarettes a day for 15 to 30 years, former smokers who quit smoking during the past 15 years, and current smokers who have no symptoms related to lung cancer. And even though fewer people are smoking these days, Colonius says researchers are struggling to figure out why lung cancer in women and men remains constant.
We're looking, and it's more probably the biology. Could it be environmental? Possibly, but we're definitely looking at more the biologic level of the cancer and trying to figure it out that way.
Because people seem to have this perception that it's smoking, smoking, smoking. But you hear more often these days people with lung cancer who never picked up a cigarette.
That's absolutely true. I mean, still smoking is still the #1 cause etiology. However, we're seeing more and more of this, and that's where really we need a lot more study and science to figure out why.
If you can please bend your knees for me, I'll put a
All the more reason that if your doctor suggests you get a cancer screening, do it. Last year in the United States, some 206,000 people were diagnosed with lung cancer. An estimated 158,000 people died from it. Colonius says he dreads telling anyone he found a cancerous tumor on their lung.
It's definitely not a happy experience. It really depends on a lot of things, though. The stage of the disease, early versus later.
Deep breath.
For Pat BURSICK, the cancer screening caught it early. Her tumor was discovered at stage 1 versus a higher terminal stage.
It's not a death sentence if we find it early. It is if you don't find it early, or if it's more advanced stage when you diagnose it. So it's an aggressive disease, and that's why the success rates are so much better and the survival rates are better when you find them at stage 1. Anything higher, it starts to drop significantly as far as survival.
Pat BURSICK regrets smoking cigarettes for 40 years.
I feel like I got a second chance.
And she's using her second chance to urge others at high risk of lung cancer to quit smoking and get screened.
Women who have smoked 40 years like I have could have a check to make sure that they don't have anything like this.
Luckily, says her daughter Marianne, Pat is sticking around to be with family and living a full life, lung cancer free.
I find it to be very amazing. I feel like we've had a miracle in our family. I feel like that little pain in my mom's back was her guardian angel tapping her on the back and telling her to go get checked. And she listened and she got her miracle.